seen the enteritis and the following the colitis. Both enterocolitis and ischemic colitis are serious conditions that require medical attention, and this is by definition. Change your wrist. Stand up from your wrist. At once, please. Keep quiet. Enterocolitis, by definition, is an infection or inflammation which manifests in what? Diarrhea and food poisoning. Diarrhea, basically, the massive fluidity, increase in the frequency as well as the quantity. And diarrhea is due to what defect? Secretory, osmotic, exudative, malabsorption, and motility of the GIT. Infectious diarrhea is caused by viruses, bacteria, and parasites. Various types are mentioned over here. The types of infectious enterocolitis, the bacterial infections definitely is so many the list of the enterocoli. What are the enterocoli? Enterobacilli, E. coli, and other players. Change your face, stand up from your face. Stand up from your action. No time. Viral infections. Viruses, just like rotavirus, inflammatory bowel disease. I'm not going into detail of this IBS. Another types of enterocolitis are due to the ischemic enterocolitis. Allergic due to some hypersensitive reaction due to some food. And the radiation enterocolitis after exposure to the X-rays and other CT scans, etc., etc. Eosinophilic, again, it's the allergic type of microscopic case. Infectious colitis is bacterial, as I have already discussed, and the mechanism is the bacterial invasion, and you know about what is the procedure to produce the diarrhea. It is the other way around of the enterocytes, either the others to absorb the liquid fluid. It is just telling out. This is the reason. And the viral enterocolitis and the parasites, which parasites are diarrhea. Giardia is Giardia is the same here to produce enterocolitis. I'm not going into detail inflammatory bowel IBS because you did it in ischemic colitis, we will discuss in detail. And this is the list of the bacteria which causes. Tomorrow, this slide will be repeated in your next lecture, tomorrow's lecture. So the symptoms of the diarrhea, the candidate is understanding the various mechanisms leading to diarrhea, such as the increased intestinal permeability, just to lose water rather than absorb, altered fluid absorption, hydration status is also disturbed, abdominal pain, cramping, visceral hypersensitivity, neurotransmitter disorders, and what is the difference between melena and French blood is what is this? What is it? Melena is because blood and hematochezia is basically fresh blood because lower portion of the intestine, especially the color. Diagnostic significance we will discuss in a minute. So, Symptoms are diarrhea, abdominal pain, fever, and dehydration. Specific symptoms for types are the infection type enterocolitis, the vomiting, abdominal tenderness. IBS is the weight loss because it is a chronic disorder in which basically IBS is manifested in a malabsorption as well, as we discussed in our previous lectures. Ischemic enterocolitis, sudden onset. So, the laboratory diagnosis, the stool culture, the PSR test for viruses and parasites, and the ova and parasites examination, stool DR, and bowel disease, the colonoscopy, the biopsies, the blood tests are elevated inflammatory markers, CRP, ESR, etc., etc. Ischemic enterocolitis, we do it with imaging, CT scanning, and the colonoscopy, the direct seeing is believing. Now the ischemic colitis. Ischemic colitis is the microvascular changes, the blood supply. Ischemia is a cut down of the blood supply. There are various reasons which causes this colitis. For the various reasons, not only a single reason is not. So the endothelial dysfunction is another cause, and this function contributes to vasoconstriction and ischemia injury. Okay? What is another name of ischemic enterocolitis? Is the mesenteric. Why? Because the colon is supplied blood from mesentery. So mesenteric colitis will get there. This supply is cut down to mesentery. So the intestine blood supply comes like this, blood supply होगा, leading to damage and the severe cases, the tissue death and the several factors can contribute to the development of the ischemic enterocolitis. If you just consider the vascular anatomy, all is depending upon the source is your own book, Robbins. It is mentioned in it as well. The supply is basically the mesenteric arteries and celiac arteries and iliac arteries. 4 supplies. So you see supply का जो है एक खास है we will discuss in a minute. तो ischemia है, reinfection injury है, exploring the mechanism of injury during the ischemic phase and the subsequent reperfusion phase. और जो है वो जाहिर बात है कि सारी की सारी जब आइटिस की बात आती है तो हमारे जो फ्लूइड्स हैं, जो हमारे जो सेल्स हैं, जो हमारी एक्यूट इन्फ्लेमेशन में इन्फेक्शन में आते हैं, तो and they are the main source of the producing the free hospital radicals. Other factors are the atherosclerosis and the embolism. Atherosclerosis, the reason all over the body, the same reasons applied in this scenario. And what happened? The fatty deposition inside the blood, arteries and stuff, and then arteries are supplying the blood supply, the colon and intestine will be occluded, and because of that occlusion, because of that atherosclerosis or embolism, supply will be cut. And it depends upon the severity. If the severity is severe, then definitely the manifestation in ischemia will be manifested just like gangrene or other acute. If it is chronic, then definitely, and the compensation of collateral circulation will compensate it. And the low blood pressure, due to any reason, if the supply is low, pressure is low. Vasculitis, infection of the vessels themselves. It also manifests, end up with the cutting of the blood supply to the intestine, and the interstitial artery spasm and hypercoagulable states. Okay? So, certain blood disorders can contribute to the ischemic enterocolitis. और हाइपोपरफ्यूजन, ये हाइपोपरफ्यूजन को भी हम उसी में डालेंगे, हाई लो ब्लड प्रेशर में, हाइपोटेंशन। तो एब्डोमिनल सर्जरी इज अनदर आर्थोजेनिक कॉज। हम जब सर्जरी किसी और काम के लिए करते हैं एंड वी जस्ट कट डाउन द ब्लड सप्लाई ऑफ द इंटेस्टाइन एंड इट विल मैनिफेस्ट एज अ, तो ये है एब्डोमिनल सर्जरी में और ट्रॉमा में है सर्जिकल प्रोसीजर, ट्रॉमेटिक इवेंट्स, देन इट विल they produce the ischemia because the blood supply cut down. तो acute होगा, it manifests in bloody diarrhea and abdominal tenderness. And ischemia enterocolitis leads to serious complications like the tissue death, the gangrene, or perforation. These are the complications as well as the sequel of the acute cause of the cutting of the blood supply. Other underlying health conditions are the diabetes, hypertension or certain medications. Vasoconstrictors, कौन से vasoconstrictor हम लोग यूज करता है? कौन से vasoconstrictor हैं जो कि हमारे vasoconstrictor हैं? What do you mean by what do you understand by the adrenaline? Okay. The symptoms of abdominal pain, the patient pain is typically lower abdomen. Severity ranges from mild discomfort to severe. GI symptoms or the bloody diarrhea, cramping. Diagnosis by medical history, the symptoms just as the number of the causes are there. So according to the causes, we have to dig out from history as well as the laboratory investigation, imaging as well as the blood. एब्डोमिनल जैसे पैल्पेशन के बाद हम मसल गार्डिंग भी हो जाती है, जैसे वर्टिकल मसल गार्डिंग होती है, इस तरीके से भी हो सकती है, लेकिन इट इज नॉट अलार्मिंग साइन। स्कैनिंग करते हैं, उसके बाद लेबोरेटरी टेस्ट में जो है चेक विद द साइंस, और जो है हम जब सीटी स्कैन करते हैं, कोलोनोस्कोपी अनदर टाइप, सीटी एंजियोग्राफी एंड ब्लड टेस्ट। ये watershed zones जो होते हैं, these are the refers to the intestinal segments at the end of their respective arterial supply. हमने देखा है ना, यहाँ पे आर्टरी, छोटी आर्टरी बनते हैं, जब कैपिलरीज बनती हैं, कैपिलरीज है, फिर वो वीडियो बनती है, वीडियो फिर नेक बनती है, and then इसमें गैप आता है, just like horizon. और the rest है वो क्या डायरेक्ट के संबंध नहीं करता है, पेड़ का बनाता है, पेड़ इस पेड़ का, where the supply is slowed down from there, the vacuum just not getting the blood right from the capillary, but from these gaps, partial zones. So these are the segments. और जो पैटर्न ऑफ इंडस्ट्री माइक्रोवेसल्स के लिए हम बात कर रहे हैं, और जो विलाय के जो माइक्रोवेसल्स होते हैं वो भी है एक हेयर पिन टाइप की, जब एक राउंड लेने के बाद आपके हेयर पिन को ड्रेन करते हैं. You know very well about it because this is already mentioned in your book. So ischemia में हमें यहाँ नजर आ रहा है, इतने घर हमें सारा नजर आ रहा है, hyperchromatic nuclear proliferating threats of the cells हमें नजर आ रही है, और जो क्रॉनिक जो है क्रॉनिक इस्कीमिया में विद एट्रोफिक जो सरफेसेस एपिथेलियम और फाइब्रोटिक लैमिना प्रोप्रिया जो है ये फाइबर से बनना शुरू हो गई है. तो फाइब्रस टिश्यू जो है वो लैमिना प्रोप्रिया में बन रहा है, और ऊपर से जो है हमारे इसके क्रॉनिक इस्कीमिया और फिनिश. कॉम्प्लिकेशंस की हमने पहले बात कर ली, स्ट्रिक्चर और इसके अलावा जो है परफोरेशन, क्रॉनिक मेसेंट्रिक इस्कीमिया एंड द इन्फेक्शन. Control of diabetes is required if you do it. अभी लास्ट टाइम तुम लोग क्या करते थे? हाँ, लास्ट टाइम तुम लोग क्या करते थे? To be done accordingly. So all rest of NPO is very important if case is acute. ठीक है? Any question? कोई क्वेश्चन पूछा? इसका मतलब है कि तुम लोग सब जानते हो. नहीं मैडम बोला हुआ है सब आता है हमारे प्रैक्टिस का पास है वेरी प्रैक्टिस हाँ वेरी प्रैक्टिस अगर तो बहुत प्रैक्टिस ऐसा सब प्रैक्टिस है एक्सटेंड आती कोलोस्कोपी क्या है भाई It's the abdominal opening of the steam outside the abdominal wall. That was the procedure to get the rest. Beyond that, the